Angel Fangs, also known as Vampire Fangs. It's two gestrums. I'm going to give you the pros, the cons, the advantages, disadvantages. I'm going to give you 5 of each of those. We're also going to go into what you should know beforehand in preparing, getting the piercing, healing the piercing, jewelry, and what happens if you say, I don't want them anymore. Coming up next on Pros and Cons by a Piercer, Season 2, episode, it's the 100th one. For those who are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos, so you find it helpful and useful, but you may be unclear of who this guy is. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and I operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So I'm talking about 2 piercings that are combined to make a lip grouping. They are 2 gestrum piercings. Gestrum piercings are done vertically. If you think of a vertical labrae, if you're familiar with that, they're done through the top lip. Gestrum is traditionally done dead center to kind of match that vertical labrae. Angel fangs or vampire fangs or vampire bites, I've heard them called too, are done more off to the side, but still in that same area. Kind of like angel bites, but they're done vertically. As far as background and history on these, lip piercings have a long history in humanity in general, especially indigenous tribes of Africa and the Americas. It is something that has been with us for a very long time. The modern interpretation, and particularly this piercing, is something that's come about in the modern era, starting in the 80s with basic lip piercings. And this is kind of a newer development. Gestrums have been around. I've seen gestrums done off to the side and off center for quite a while. The combination of the 2 of them and calling them something, because it kind of became kind of a fad there for a while, and putting long spikes in them. That's kind of a modern thing, I'd say, last decade, if not less. Now let's move on to the pros, the advantages, the things that make you go, yes, I'm going to march right down to that piercing studio and get that right now. Starting with number 1, long history of healing. This is not a new piercing. It's not experimental. It is something that has a history of healing with. There are some issues with any of these piercings, especially this particular one just because of its location. But for the most part, take care of it properly. If it's done properly, placed properly, and you wear the proper jewelry in it, it's a lot of propers. It's very proper. You're probably not going to have any issues with it. It's going to heal fine. Number 2, everybody's favorite word, symmetry. It's one of those things that matches and fits. And us humans, we like things that are booked in and match for some reason. Number 3, a quick heal. This piercing, unlike a lot of other piercings, well, not a lot of them, but it has a very quick heal and has a tradition of healing fairly rapidly, anywhere from 2 to 3 months. It's not something that's going to take 6 months to a year. So on the scale of all piercings, it's one of the faster healers. Number 4, can be done in stages, meaning if you want to get one side done, heal it out, and then do the other side, that's perfectly possible. It's not something you have to kind of impact everything in your mouth at once. Kind of, stage it out and not have as much to deal with at one time. Number 5, reduced risk of damage. Because these piercings don't actually enter into the mouth. No part of the jewelry is sitting actually inside your mouth. There's a reduced risk of enamel erosion, gum erosion, and softening of the bones inside your mouth. The ball tends to be on the underside, just inside or just outside the mouth, and the top one is well outside the mouth. Now, chewing on it, playing with it constantly, and that will cause problems. You will occasionally catch them too. So it's not 100%, but it's a little bit less than having a labrae stud that is directly into your mouth. It has a disc on the back. Now let's move on to the cons, the disadvantage, the things that make you go, nope. And run away screaming. Starting with number 1, risk of damage. As I just talked about, there is always a risk of damage, and because you have 2 of them, one on each side, that doubles up the risk. So there is a definite risk with these. Number 2, placement of this piercing and the way it's done and the type of jewelry or the type of piercing it is there's only really one type of jewelry you can wear in that, and that's curved barbells. You can't put labrets in these. You can't put rings in these, or straight barbells. It's just not going to work well. There are some alternative pieces that have been coming out slowly but surely that might work with this and various different concoctions, but for the most part, you're kind of just stuck to that style. Number 3, like all oral piercings, this is going to swell. Swelling can be kind of a pain. Also, it's going to involve, because of swelling, reducing or changing your diet, limiting and kind of sticking with bland, simple foods for a while. So it's something you'll have to deal with. Adaption-wise, not nearly as much as other oral piercings, but that's still a factor too. And that comes with getting anything in your mouth or around your mouth. Number 4, scarring. With facial piercings, especially with oral piercings, the scarring tends to be a little bit more intense and a little bit more noticeable than other piercings. And if you have this in for a few years, it's going to look open for decades after you remove the jewelry. So you need to understand that getting this piercing, it's going to look open for a long time, and you're going to have scarring there for a long time. Number 5, can close pretty rapidly. Oral piercings, your body's kind of like an overdrive in that part of your anatomy, so it's not uncommon to have these for 5 or 6 years, take them out for a couple hours, and have problems getting the jewelry back in. It is definitely a piercing where you do not want to leave the piercings empty. And a bonus one, number 6, anatomy. You have to have the proper anatomy to get this piercing done. The more duck-like your upper lip is, the better success rate you're going to have with this piercing, the better it's going to sit, and the less of a hassle it's going to be. If you have a very flat upper lip, it's not going to be a good option for you. Your piercer should discuss this with you before doing it. It's something we tend to do and give you other options. Preparing for the piercing and what you should know beforehand. Basically, I say this on all oral piercings. Go out, get a great meal, indulge yourself before you come into the studio. Don't eat to the point where you feel nauseous, but get something that you would really enjoy and that you're not going to be able to have for a while. Just kind of indulge yourself. Bring a friend along. Just make a date of it. Prepare your home. Preparing your home, I did a whole video on this, and everybody was confused because it said making your home piercing safe. I thought everybody understood that, but everybody thought I was making a video called Making Home Piercings Safe. Like I was telling them how to do piercings at home, like I would ever. No. There's no way to make them as safe as a professional environment. Anyway, that's another video. Preparing your house involves things like buying the food ahead of time that you're going to be able to eat, kind of getting that diet ready for you, changing your sheets, getting your environment clean, doing the laundry, and also removing food items and stuff that might be tempting to eat that you can't eat. Because nothing sucks more than you got your face is all swollen up and you open the fridge and everything in there is looks really inviting, but you can't eat any of it because it's going to lead to more swelling. So kind of prepare everything in advance so you don't have to run around and do all that stuff the day of the piercing. Check with work or school. If you're involved in any type of organization or work or what have you where there's a dress code, check with them before you get the piercing done. Nothing sucks more than showing up on time and having somebody of authority go, you are either taking that out or you're going home and not coming back. It sucks because you're proud of this new piercing. You're so excited about it. So you have the choice of either abandoning it or not participating or not having a job. Talk to your supervisor or coach, whoever's in charge beforehand. It's better than trying to, doing it and then asking permission later. That never works out well. One thing you should always understand before getting any oral visible piercings is that it can affect employment and even after you remove the jewelry. Some employers, lip piercings tend to be more on what people consider extreme, especially because they're one of the few visual piercings that most people are like, well, why would you ever do that? Ooh, gross. It tends to have that reaction. So it may affect employment, and you need to consider that. Maybe if you know somebody in the field, like if you're training to do something, or you have a goal of becoming this type of career, maybe talk to somebody that's in that career and see what their tolerance is on piercing before you get it done. And understand that, as I mentioned at least twice already, the scarring can last a long period of time, and it can be very visible. Choose your piercer in advance. You need somebody that's experienced, passionate, loves to educate people about piercing, and is going to provide you with all the information that you're going to need to heal that piercing out properly. Also go through a consultation verbally with you, checking your anatomy, making sure it's right, and going through telling you some of the things that you're going to have to go through to heal this piercing out in advance. Your piercer should also be very experienced with this piercing in this grouping. If it's somebody that's just starting out, they probably don't have that type of experience because it's a bit of a rare piercing grouping. Understanding cross-contamination prevention. I'm going to go in depth into this a little bit later in the video, but you need to understand that one of the biggest parts of getting a piercing and healing it out is making sure that it doesn't become infected. And the most effective way of that is eliminating the possibilities of a microorganism or other pathogen entering the piercing, which is a wound. In this case, you'd have 4 openings. Understand the diet changes and what you're going to have to go through for probably that first week or so, and that this does involve a little bit of adaptation on eating, talking, and drinking. Prepare for that beforehand and understand what you're going to go through because it is annoying, to say the least. One thing I always tell people to ask is, does your piercer provide written instructions on Aftercare and also go through at least some of the basics verbally? I think it's very important because sometimes things can be a little bit confusing. I'm not a fan of people that give you a QR code and go, yeah, just scan that. It's all on our website. You need to kind of have something, a piece of paper that you take along with you with the date of when the piercing was done, jewelry information, when to downsize, who did it, and how to get a hold of them. Basic stuff. And it only takes your piercer 5 minutes tops to go through some of the basics. Downsizing the jewelry. It's always going to be a factor with any oral piercing because we have to allow for put longer jewelry in to allow for the swelling. Usually downsizing should happen in 4 to 8 weeks. The main reason why we want you to downsize is to limit the movement. This will also cause the balls to come more out of that lower part of the lip. So it'll move it further away from your teeth because it's tightening up the curvature of the barbell, the curved barbell. Getting pierced. First thing that's going to happen is you're going to walk into the studio and you're going to go through a consultation. The consultation generally will cover things like how to take care of it, what they're going to suggest for aftercare, cross-contamination prevention, the discussion on diet and swelling, also any risks that are involved, and checking your anatomy to make sure you can actually get the piercings. Next, we select the jewelry. Like I said, it's kind of limited with this. It's just curved barbells, but there are different ends, and depending on the studio, they may stock a lot of different options. So you get to do that fun part. Once that's all done, usually we hand you a waiver on a tablet, and there's going to be some questions in there about things like your age, any type of intoxicants you may have in your system, any type of medications, prescribed medications that may cause issues during the piercing, any health conditions that you may have that may cause problems. Fill these out honestly, and if one of them is kind of like, I don't have this, and you do, talk to the piercer about it. And when in doubt, if you do have one of those conditions, talk to your physician before you get the piercing done. If you're on a medication that causes thinning of blood and etc., talk to your physician before getting the piercing done. The next thing we do is we set up our equipment, disinfect the area, and then mark them. When you're looking at markings, always look at them up close, but also at arm's length. The reason why is normal people do not see you like 3 inches from your face. Most people see you from far away. So you want to make sure that they match from a distance, a further away distance. I even ask, if the piercer is holding up a mirror, ask them to step back. Ask for second opinions. Marking the piercing and placement is always collaborative effort between the piercer and the client. Always give feedback. Don't do this whole I trust you, I don't even need to look at it. Do take a look, because it's easier to move a mark than it is to re-pierce. Then this one is either done freehand or with forceps. It really depends on, when I look at the piercing, what I think is going to work best to get that piercing done. I've done it both ways. The needle is injected in and through in one smooth motion. Forceps are removed if they were used. Then the jewelry is inserted using a guide pin. The guide pin's removed. The end is put back on the jewelry, clean up any bleeding that may have occurred and stop it, and then move on and repeat and do the other side. As far as aftermath with this, you'll probably have some redness, discolorization, but also maybe some throbbing and aching for a few minutes afterwards, sometimes a little bit of slight bleeding, and it's just going to feel strange to have that jewelry there. And that takes a little while. That's called the adaptation, and that can vary greatly from person to person. Pain. I get a lot of different results on this one. I've heard everything from, that was a 2. My navel hurt more. 2, that was a solid 6 or 8. So it varies from person to person. Some of us are a little bit more sensitive in that part of the body than we are in other parts of the body. So kind of, in most cases, not so bad. I would say 99 or 95%. But every once in a while, somebody hits that early. I guess they just have that sensitivity right there. But it's not something you can't live through. Healing. Average healing time on these is anywhere from 2 to 4 months, during which time I suggest cleaning twice daily using a sterile saline spray. I personally like Neomed's Piercing Aftercare. Comes out in a fine mist. But not everybody in the world stocks it, or you can find it. So what you want to look for if you have to go out and find it is you need something that's in a metal pressurized can. It should say sterile on the packaging. And when you flip it over on the back and look at the ingredients, there should be nothing in there other than water and sodium chloride. Salt, or water and salt. That's it. If it says baking soda or specially this, that, or ruby red sea salt from the scrolls salt or any other nonsense, that's not what you need. It just has additives that could cause issues. So you want to use that saline twice daily. It really depends on how it delivers. If it comes out like a fine mist, like Neomed's Piercing Aftercare, just spray the area and leave it alone. You don't even have to really dry it off or clean it off. You can usually just let it air dry. If it comes out like a squirt gun, like the nozzle is really powerful, you really want to do compresses. Take a sterile piece of gauze sponge, saturate it to the point where it's really damp, and then just lay it against the piercing and do a compress for about 5 minutes. The thing I suggest doing is, at the end of your shower, kind of tilt your chin out and let the water flow over the area for about 30 seconds to a minute. What we're doing with these two things is we're removing that hard discharge. People refer to as the crusties. The reason why we want it off there is when the jewelry shifter moves, it can agitate it, which doesn't feel good, and it can lead to issues. The other problem a lot of people seem to have is they want to get absolutely every little bit of it off. If there's a little bit on there, it's not going to cause a huge problem. But if it starts to build up, or there seems like it's not coming off at all, see your piercer, have them clean it for you, and make sure there's not something else going on. Otherwise, don't run and grab Q-tips and things that dig around in there. You're going to cause problems. I also suggest rinsing twice daily with a alcohol-free antiseptic mouthwash. Most common on the market is Biotin antiseptic mouthwash. Just rinse a couple times a day for about 30 seconds. Saltwater rinses, warm water and sea salt is really not as big of a factor with this because the majority of the piercing is outside of your mouth. You can try it if you think it's going to help, but I don't think it will. Swelling lasts about 3 to 5 days. You're going to see the worst of it usually the morning after or the second morning. You want to greatly reduce it by cutting down your intake of tobacco, alcohol, cannabis, hot and spicy foods, things that are extremely warm in temperature, or anything that may agitate your mouth, like vaping. Some people have no problem eating spicy foods and all kinds of other acidic foods and etc. But if you notice pain when you ingest them and it's directly at the piercing, not just your tongue, you probably should avoid them until it no longer does that and the swelling is gone, because it probably will lead to more swelling. Soft foods, things like baby food, applesauce, yogurt, smoothies, cold items, ice cream, etc. are great options, especially in that first 3 to 5 days. Once you start to wean yourself onto solid foods, it's best to stick with kind of not really complicated foods or mushy foods. Things you can kind of pick up with a fork, shove directly back into your molars, chew and swallow. The adaptation is probably not going to be as bad with this because it's not so much in your mouth, but do be patient. It's going to be very frustrating maybe at some times, especially with drinking. Give it time. Eventually, it will become normal, or you will adapt to do it in a way that doesn't affect the piercings. Stay hydrated. Staying hydrated will help reduce the swelling. Also, sleeping with your head elevated above your heart keeps the blood from pooling around your mouth and then increasing swelling. So that'll reduce the swelling too. If you've never had any problems taking over-the-counter anti-inflammatories such as ibuprofen or Tylenol, it shouldn't be an issue, and they can help. If you're unsure, like you're on some type of medication that may be affected or you're unsure if it does, always check with your pharmacist or your doctor just to be on the safe side. The other thing is CBG oils have been known to help with inflammation. Just don't pour it directly on the piercing. Just ingest it. That's one of those things. There's still research that needs to be done, but I guess it does help with some people. Adaptation is a big thing with this, as I mentioned before. Changing how you eat, kiss, drink is going to be part of this process. This is why I try to talk people out of getting super long spikes put on them, because it's not going to make many things very comfortable or fun. It's just going to get in the way. The bigger the jewelry, the more it messes around with stuff. You are going to have to kind of learn to adapt to this, as maybe drinking out of a straw instead of sipping things. It's going to change things a bit. You need to practice cross-contamination prevention. Most of this is common sense stuff. Things like washing your hands before you handle it. No deep mouth kissing, oral contact, or sexual contact for a minimum of 8 weeks. You are more acceptable to STDs during oral sex, even after these piercings have healed, because you have soft metal through hard tissue, so there's always a possibility of causing a tear. So anytime you switch partners, practice safe sex before you've both been tested properly. Just be safe, people. Keep your environment clean. Clothing, bedding, towels, pillowcases, anything that may come in contact with this does need to be cleaned on a regular basis. Keep pets away from it. Do not let them sleep in the bed with you, especially those that like to sleep up by your face and mess with you while you're sleeping. No swimming. I don't care how clean that lake looks. Anytime you can get in a body of water and move around, it is filled with microorganisms. They can work their way into the piercing and cause an infection, especially if you plan on being in there for a long period of time. With natural waters, there's the added risk of pollution and that having an effect on those healing piercings. With treated pools, there's always a risk the chemicals or even the saltwater pools could cause a negative effect to that healing piercing. Just stay out of the water. It's not that long. You'll have the rest of your life to do that. Keep your own utensils that you use to eat with clean on a regular basis. Do not share food items or utensils with other people. Understand, and this is something I should have mentioned earlier with eating and adapting, opening your mouth super wide may be uncomfortable at first. So stay away from giant hoagies and burritos at first until that's a little bit better seasoned. Do not use whitening products. Whitening products can affect a healing piercing, so you're going to have to abstain until they're healed. Avoid playing with a piercing and excessive movement. Constantly playing with the balls and doing stuff with your mouth is going to increase. It's basically going to prolong the swelling and make it last longer, and it's going to prolong the healing. It can also cause tearing, migration, rejection if done enough. So leave the damn things alone. As I mentioned earlier, it's not uncommon for the first 3 to 5 days to maybe see a little bit of slight bleeding, sometimes in the morning. Also, it's not uncommon to see redness, discolorization, heat, tenderness of touch, inflammation off and on during that period. Downsizing. One of the things that will keep you from playing with a piercing and reduce the amount of trauma and contact the piercing has is downsizing the jewelry. Sometimes we have to pierce a little bit on the big side to allow for that swelling. Downsizing to a shorter post is usually a good option. It's going to make your life easier. It's going to make it easier to do those things you do every day, like eat and talk. And also, it's going to be more comfortable. As far as downsizing, unless you have the proper tools at home, I don't suggest doing it yourself. Go see a piercer, have them do it for you. The place that pierced you should have possibly a discount or a service that's free to do that, because any piercer worth their weight in salt is going to want you to downsize the jewelry because it's going to make the piercing heal better. Jewelry. Curved barbells are your best option, or curved or curvies or what have you. There are some other things in the market that may work, like J-bars and etc., but you kind of want something that fits tight and fits into the curvature, natural curvature of this particular piercing. There are a lot of different ends to choose from. Just make sure you don't choose really complicated, big, giant things that are going to get in the way of your daily life. Use some common sense. If there's something that's 3/4 of an inch long coming out of there, it's going to get caught and snagged on everything you come in contact with. Clothing, the person that you're intimate with, every food item that goes into your mouth. It's going to be a pain in the ass. So use some common sense. Should leave the jewelry in at all times. Oral piercings are notorious for closing very rapidly. So it's best, if you like it, leave something in it. Ends should be checked on a regular basis. I usually suggest weekly. Pick a day of the week, like Monday, and Monday's ball checking day. Put it in your calendar so you don't forget. If jewelry is loose fitting or too long, downsize to something that's snug. You're going to be happier. The piercing is going to be happier, and we'll all live happily ever after. If you have a medical situation where you cannot have metallic jewelry in, glass can work temporarily. There are glass retainers that will fit. They do make curved ones. They're not very secure, but they'll get the job done of keeping the piercing open without causing damage, and still not be an issue with scans or surgery. Living with a piercing. Check the ends on a regular basis. Already covered that. Continue to avoid contact and trauma against the piercing. Even after the piercing is healed, it is still acceptable to trauma, and it can be affected by it. It can be affected by obsessive playing with it. All those things are problems. So try to kind of isolate the piercing and baby the area. It's just because it's healed doesn't mean that you can put 15-pound weights on it and all this other nonsense and not have problems. It is hard metal through soft tissue. Which do you think is going to give first? Leave jewelry in at all times. Already covered the reason for that. Always practice safe sex with new partners when doing oral sex. Brushing the jewelry and using an anti-plaque mix may help, or rinse, not mix, may help to reduce plaque buildup on the jewelry. This one, because it's not as much in your mouth, doesn't usually have that issue as much as, like, say, a standard labret would, or tongue piercings, etc., because there's not as much surface in contact with that area. But it's not a bad idea to just brush them on a regular basis, like maybe a couple times a week or something, if you notice it starting to build up on there. And you will notice, because the balls will become rough. Abandoning the piercing. You got to a point where you just don't want them anymore. The thrill is gone, and it's time to move on. If the piercing is healed or in the process of healing, and there is no sign of infection or other problem or issue, removing the jewelry shouldn't cause an issue. I do suggest that you monitor the piercing area as it begins to close. If there's any signs of infection or other problem, see your piercer or contact a medical professional. Do not put it off. If there are any signs of infection or other issue, consult your piercer or a medical professional before removing the jewelry. The main reason for this is we do not want to create a situation where the infection or whatever is trapped deep inside the piercing and then sealed up in there, and then will require more medical attention later. So always consult somebody if there's an issue, just to be on the safe side. Usually what will happen is if the piercing is healed, your body will seal up kind of the center of it, kind of collapse it, and then slowly fill it up over time, over decades usually. If it's during the healing process, the holes will probably just close. They'll heal over just like it would any other puncture wound, because there hasn't been that additional time for the body to produce scar tissue like it would if you went through the whole healing process and then the seasoning. Lastly, sebum. If you watch any of my videos, I talk about this on every one of these. Sebum is a waxy oil, has a consistency when it's sit for a while of cream cheese. Smells like I don't know. It smells like dirty belly button. Very distinct odor. I don't think I've smelled that odor anywhere else. It is completely harmless, but sometimes it collects inside crevices or around scar tissue more than it does in other parts of the body. So guess what a piercing is? So if you have an abandoned piercing and you squeeze it and this white stuff comes out, it stinks really bad, you don't have an infection. That's completely normal. Stop squeezing the piercing. There's no reason to do that. It's not something you need to worry about. Do you have angel fangs or vampire bites, whatever you prefer to call them? Leave a comment. Let us know what your experience with those piercings was like. Any hints that you may have for other people. We like to share things around here. If you have a question about this piercing or any other piercings, please leave a comment. I usually answer questions when I have time. Of course, like, subscribe, do all that fun stuff, and hit the notification bell. Till next time, here's hoping your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I would love to see you for your piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in the next video.